어디가 불편해서 왔어요?
악관절 여기가 벌릴 때 여기가 아프거든요.
왼쪽이?
네, 그래서 여기가 이렇게 다 아프더라고. 두통이 와요.
언제부터래요?
원래 이렇게 크게 벌릴 때 소리 난 거는 20대 초반부터 그랬는데 통증이 생긴 건 한 일주일 정도 된 것 같아요.
양쪽 편두통이 다 와요?
네. 사실 크게 아픈 건 이쪽인데 머리가 아픈 건 이렇게 와요.
또 불편하신 것도?
자주 여기 목 근육이 뻣뻣하고 제가 이렇게 움직이면 뚝 소리가 나더라고요. 옆으로 움직이면. 그리고 등이 항상 잘 뭉쳐요.
벌렸다가 내렸다가 반복해. 그러면 점점 턱의 통증이 줄어들면서 더 벌어지는 걸 느낄 거예요. 크게 벌렸다 닫았다. 여기 오기 전에 비해서 벌어지는 건 어때?
약간 편해요.
편해졌어?
네.
아까보다 통증이 10개만큼 아팠었다면 몇 개가 줄었어?
6?
6개 줄었다?
네.
어땠어요?
통증은 많이 줄어들었고요. 약간 벌릴 때 걸리는 느낌이 있어요.
통증은 한 얼마나 줄었어?
거의 70%?
10%? 크게 벌려봐. 한 번에 벌어지네?
네.
편두통 있다는 건?
약간 있어요.
그럼 많이 줄은 거야?
네.
뒷목, 등, 어깨 통증.
어깨, 등이랑 이런 데는 통증 없고요. 약간 뒷목은 좀
턱 아픈 거는 또?
아프진 않은데 벌릴 때 약간 걸리는 느낌.
편두통.
통증은 없죠.
전체적으로 좋았어요?
네.
턱이 아픈 거는?
턱은 그냥 약간 그 걸리는 느낌이 있는데 아프진 않아요.
전에 두통도 심하다고 그랬는데
두통.
등의 통증도 이제 별로.
네, 등 통증 없어요.
FCST is abbreviation of Functional Cerebrospinal Therapy. It is treatment to control whole body's yin-yang balance through balancing TMJ. The purpose of balancing TMJ is upper cervical alignment, spinal alignment, nervous system stabilization, and natural healing of body. That is to say that FCST helps to open up the blood channel that connects brain and body, realigning the spine, stabilizing nervous system. What factor causes misalignment of spinal structure? The answer is in C2, which is the one and only central axis of the spine. Then why is the C2 important? Human body has 24 vertebrae, which includes cervical, thoracic, and lumbar. Of all these vertebrae, there is only one vertebra with an axis, the C2. Our body is affected as axis C2 is distorted. When the axis C2 is distorted, the atlas C1 is also immediately distorted, and the rest of the vertebrae in the spine will soon follow, as will the pelvis and cranial bones, like in the domino effect. Consequently, it will lead to the cranial structure fixation and the restricted flow of cerebrospinal fluid. Then, there will be problems on the circulation and central nervous system. What factor causes misalignment of axis C2? The answer is imbalance of TMJ. Once the C2 are distorted due to the TMJ imbalance, the entire structure will follow and distort. And this will negatively impact on the brain-body communication through restriction of foramen magnum, as well as restriction of jugular foramen, another opening in the base of the skull transmitting veins and arteries. When the TMJ disc space is normalized through TMJ balancing therapy, C2 is aligned as well as the size of foramen magnum is normalized. I've explained in what aspect I see the disease and its principles and concepts. I put everything in one diagram for the summary. For the better understanding, I rotated the horizontal diagram in the previous slide into the vertical diagram. The treatment applied to the higher rank can be the treatment in the lower rank. In the lower rank, more specific therapies are applied. I consider balancing TMJ as top priority factor to resolve structural problems. For the TMJ balance, I make use of intraoral devices as a main treatment. There are two types of intraoral devices used for balancing TMJ. CBA is disposable custom-made intraoral balancing appliance which allows balance of TMJ at the optimal freeway space to the individuals until deflection. The purpose of CBA is to align C2 at all times through balancing TMJ in relation to maxillary and bodily posture. TBA and OBA are intraoral devices for keeping TMJ balance stable after the use of CBA when deflection has occurred, and keeping C2 in aligned position and stabilization of occlusion and mandible. I apply a wide range of therapies other than TMJ balancing therapy. These therapies are applied for structural alignment. There are upper cervical and spinal alignment technique, spine balancing therapy, craniosacral therapy, and disc decompression balancing therapy. There are other secondary therapies as well. Depending on individual's condition and need, I apply different types of secondary therapies like as acupuncture, cupping therapy, herbal medicine, counseling program, and rehabilitative exercise program. This chart shows the number of cases in my clinic from 2002 through 2013. I listed several diseases based on the highest ratio of patients.